I am the mental health and wellness specialist here at the Marriott School of Business for BYU. And I do most of the mental health, well, all of the mental health, not most, I'm the only one, all of the mental health for the business students. I also do outreach and prevention and do some programming with faculty and staff around mental health. And I have here Missy Larson and Barbara Stallone, who are from SafeUt. So SafeUt is an app and organization that works with suicide and self-harm prevention. And my first question for you guys is that both of those topics are big and they're on the rise. They're also personal and intimate. And so how did you get involved with those, and what's your connection to those topics?
Well, great. Well, hello, everybody. Are you exhausted? Do you need to stretch a little? My name is Missy Larson. I had the privilege of working with Barbara, and we'll go into this in just a minute. But I started at the Utah Attorney General's office as Chief Communications Officer in the very first business day of 2014. So that was Sean Reyes's third day in office. And I had on my desk one piece of paper, and this one piece of paper was a program that came out of Colorado, called Safe to Talk?
Safe to Tell.
Safe to Tell. And it was a program where students, after Columbine and some of the tragedies that have happened in the school shootings there, could call or reach out to the Colorado Attorney General's office to submit tips around people bringing guns to schools or things like that. At the same time, some things were percolating over in Barbara's area, so I'll let you get to that point, and then I'll jump back in.
So for me that year, I was working as a legislative assistant for Senator Daniel Thatcher, State Senator Daniel Thatcher, and he had a really big idea. And his big idea had nothing to do with Safe to Tell. But his big idea was he wanted a 3-digit crisis number, like we have for 911. He wanted 311, so you could just dial and say, I'm not okay today. And so Missy and I ended up working together on that particular piece of legislation. So for today, if you don't hear anything else we say, the piece I want you to take away from here is that your big win doesn't have to look like what you think it does when you start.
It never does.
It never looks the way you think it will.
But it's sometimes even there.
And I think that's the important part of the whole SafeUt story is not only did we end up with that 3-digit number, we ended up with it nationally, but we also ended up with something here, very, very local, that all of you in this room can use to keep yourself safe.
By show of hands, do you have SafeUt on your phone?
Yeah.
Nice. Okay, for those of you who don't, you easily go to the App Store, could be any App Store, and you look under SafeUt.
Yep.
It can be parents, it can be anybody in this room.
You got it?
There's QR code.
Oh, QR code right there.
Perfect.
Download the QR code. It is good to reach out 24/7. You can reach out, and this goes to crisis support therapists at the mental health hospital at the University of Utah, the Huntsman. It used to be the University of Utah Neuropsychiatric Institute. It is now the Huntsman Mental Health.
And one of the other really important pieces, like maybe you don't want to put it on your phone because you don't want people to know, right? You don't want people to know you might be struggling. You don't want people to know you might be having a hard time. But I will tell you that the most effective times that I have used SafeUt for myself is when my children's friends have come to my house and sat on my couch, oh, sorry, didn't expect that, and started crying and said, I don't know what to do. And I was able to open my phone and say, I don't either, but these guys do, let's get you some help, okay? So if you don't want to put it on your phone for you, put it on your phone for somebody you know. Put it on your phone for somebody that you love, because we save lives with this program every single day. So the stats they just keep going up, right? But the other stat that keeps going up is the number of lives impacted and the number of lives saved.
So back to that legislative session, since we're talking about the innovative ideas, is that legislative session was really difficult. Me and Senator Thatcher, Barbara was there, and our legislative attorney within the office, Wade Fairway, we went to battle. It was really rough. And we were only able in that first session to get a commission out of that.
And we weren't even going to get, let me be very clear, we weren't even going to get the commission because the legislature refused to provide a staff member to take minutes and agendas and post them to the state transparency website. We weren't even going to get that much. When Senator Thatcher, well, actually it was Sean Reyes who came to Senator Thatcher and said, dude, what's up with this bill? It's one of my priorities. Where's it going?
And at that time, the AG said, we'll staff it in our office and we'll figure out how to staff it.
Yep.
So I stepped in as chair of the commission, and I had an assistant that was one of the assistants in the office who was working on projects, who really took the project, Catherine Rhodes. And she stepped in and we started meeting with people and trying to get to the bottom of this. We ran into all sorts of political problems. And I'll tell you one, and I'm going to be very verbal about this because I love John Curtis because of this. John Curtis was mayor of Provo at the time. They had been using 311 as a municipal service line. And we were thinking very limitedly. We were thinking that the only way you could do a 311, a three-digit number, was to use the ones that the FCC had already okayed as three-digit numbers. So we were thinking, okay, well, we can't use 411 because that's for this. We can't use 611 because that's we were going through all of them. So the one that we kind of came into was 311. Well, that was set as a federal FCC line for non-emergency municipal support.
Right.
We kept telling ourselves that this wouldn't be an emergency because we were trying so hard to fit into this FCC criteria.
Right.
Well, so John Curtis said, I've already put hundreds of thousands of dollars into the municipal usage of this, where people are using this to call in to get road information and different things for the city of Provo. And it's working. People are using it. But if one life can be saved, I'm willing to talk. Now, that was exact opposite in Salt Lake County at the time, and happened Ben McAdams was a good friend of my family's, and they started playing massive political games where they even turned on a fake 311 number for the legislative session, where if you picked it up and dialed it, it would go to Salt Lake County and they would act like they were using it. It wasn't funded. My sister was on the council, said, we haven't funded that. So games play in those early days. Yeah. But we pushed it, and when we got into that and we got that commission form that first year, we all met for a year, and all of a sudden the real ideas started coming out at the table. Right. And we were able to put the right people at the table to have real discussions around how to really solve this. And there was one woman in particular that said, why are we even talking about the problem in a way that the students aren't going to use? They text.
Right.
And this was early app. Like, people were not getting into apps that it was very early app.
Well, and I'm wondering, from kind of what you're saying and the obstacles that you have encountered, that's kind of on more of a statewide and the legislator. But I think that there's even a barrier just talking about.
Then there was a huge barrier.
Yeah.
So one of the biggest things that would happen is Senator Thatcher, especially because he was kind of leading the charge, he would go talk to somebody about the bill, and people would say, why are you talking about that? That is so depressing. You know you're going to lose your next election if you keep depressing people. Don't talk about that.
Don't talk about suicide because it'll create more suicide.
Right.
And that's a question that I have. So for the people that are here, what are some things that they should know about suicide prevention? So for our audience, for our students, for our faculty, what are some misnomers or some false information or myths?
That was a myth early on, that if you talked about it, it created it. Now, where this came from is there happens to be copycat situations with public suicides. So there is a higher risk when somebody you love dies by suicide. There's a higher risk because it is somebody that you know, that you've loved, that's actually gone through that process. So there is kind of this real little piece to this that the tentacles need to come on if there is somebody who, but that is something that you need to be aware of. The reality is the support that is offered through a SafeUt is all therapists. Yes. It's not volunteers. It's not somebody who just is going to give you anything that they feel at the time. These are trained professionals who are on the other side of this. And that was the other thing that we were up against, is how do we actually pay for this service? Because this service is a really tricky service to be able to pay for. It's expensive.
It is.
And it's hard to find the right people.
So
How would a layperson know, like, okay, my brother, my roommate, my dad is showing signs towards self-harm or towards suicide that I should call SafeUt?
So what I love about this app is that it's available for any Utah resident. If you have a question, call them or text them.
So let me tell you how many people used it last year alone. This is 2023, just last year. These are the main stats. There were 536 life-saving interventions. These mean active rescues.
So that means when someone reached out, the clinical therapist on the other end believed that their life was in imminent danger and that they actually had medical professionals dispatched immediately to their location. That's 536 people who are alive today. And the stat right now is that for every person who completes suicide, there are a minimum of 25 additional lives impacted by that loss, right? So do that math, because I'm not a math whiz, I'm not doing it.
Now, these can be pretty triggering, and so if this is triggering to you, it's okay to get up and walk out. It can be, and so.
And please be aware that if after this presentation you're still struggling, please reach out, because the people who love you need you. This app is available. You have support through the school, but please,
and nobody's going to be angry at you for reaching out about somebody else or anything. You can use it in any.
And before we go on with these stats, one of the things I want to be clear about is that one of the key pieces of SafeUt that makes it really effective is that not only do we have a chat feature, but we also have a tip feature that allows you to report if, let's say, for example, you have a roommate and you're really concerned that that roommate might be hurting themselves or their boyfriend might be hurting them. Or one of the big things right now in schools is, hey, I'm going to bring a gun to school, right? That tip feature that is available for our high schools and our K through 12, that tip feature that is available, that is saving lives every day as well. So if you have a concern, you can use that tip feature to report.
And your kids, the adults in the room with kids, they can use that at any time to report different drugs coming to school, even bullying. It can be used as a tip line for, some of the any sort of danger coming into the schools.
Right. And I can tell that both of you are very passionate about this topic and the work that you do. Right. And as a mental health provider myself, I know that when you're working in this field, when you're working on this particular topic, it can be pretty draining on you, and there's kind of secondary trauma for families and things like that. How do you kind of replenish? How do you take care?
Brought that up, because after the SafeUt was put together for students, there were a couple of groups that came back and said, we have a totally different secondary trauma world that we need support with, and it's going to be a little different than what the students are reaching out. And can the therapists be trained for the secondary trauma? So there's actually SafeUt for first responders, and that's healthcare, fire, police,
dispatch,
those who are dealing in secondary trauma. And there's also National Guard, SafeUt.
SafeUt NG.
And then the other one, Oh, no, those are the two.
Those are
other
the two.
ones that go. And the reason why Barbara brought up the 3-digit number was because after the session, after SafeUt launched as an app, Orrin Hatch did take the 3-digit idea back to Washington, D.C.
Right.
And that passed, went through the FCC. Today, you can dial 988 at any time and receive mental health support the same way you would 911. And it's critical for everybody to know 988 exists, and it's nationwide, and it started right here in the Utah State Legislature 2014.
That is amazing, ladies. Thank you so much. And I know we're kind of running out of time
I just
a
want to
little
give
bit.
one more stat.
All
Because
right.
this is pretty amazing. Okay, so
Absolutely.
last year, there were almost 10,000 tips that came through 1.1 million chat messages. So it's being used. Please share it with people. It's really, really important for them to know that there's support somewhere, because this is the funny stat. 94% of users feel that the SafeUt counselors usually or always show respect for what they have to say. Now, these are teenagers. Do you think if they asked if they thought parents showed respect, it would be at 94%? No way.
Yep.
Well, as we wrap up, I would love to hear from each of you of if you had something to tell this audience, just one thing that you want them to know about suicide, about self-harm, about Safe Utah, about how to get involved. This is a group of people who really want to get involved and want to do social change and be out there in the world doing good. What advice or information would you want them to know if this is a topic of interest to them and they wanted to get involved?
So that one actually is a little bit tricky because SafeUt became really a project owned by the state of Utah, right? And so it's really important to recognize that we're not saying no because we don't want your help or support. It's that the people who answer the phones are trained clinical professionals, but there are other ways that you can be involved. And one is put it on your phone. One is talk about it. Go to your places of worship and talk with your leaders about whether this is, available, whether you need to teach the youth about it, whether it's, make sure that the people around you, the people that you love, number one, know that you're a safe person that they can talk to. And number two, know that this product is available. And that's really the most important thing that we can do. And then the beginning of your question was just the one thing I'd like you to take away. And that really is that this big idea didn't start here. It wasn't, what we have now is so completely mind-blowingly different than what we thought we would get. But that we have that 9-digit or that 3-digit number nationally, that was never the plan. But now we have it. And you watch it on the ends of your TV programs, and you see it at the ends of articles about things that are happening. And then when you're thinking about yourself, please, please, please recognize that there are people, even when you don't think there are people who love you. There are people who need you. There are people who want to help you. And if you don't know who they are, reach out through SafeUt and get some help and support, because it's there. And it matters, and you matter, and thanks for being here today.
Thank you, Barbara.
Well, so I'm going to take a little different approach on this. All of these crises come because of loneliness. And Samira just sat here and talked about the refugee women and how she solved a problem of loneliness. And I watched this happen. I founded the Utah Refugee Coalition in 2009 and saw Samira as she was really putting together this beautiful story for the women of the world. And they're beautiful women. And they bring beautiful, beautiful aspects of the world to Utah. But they were lonely. These kids that are reaching out, the vulnerabilities, it's loneliness. Adults, it's loneliness. People getting stuck online in all sorts of things online, it's loneliness. And I think today, I can go a little broader here because I am sitting on the campus of BYU. Today is Good Friday. in all of history. It's the darkest day. But Easter comes. Think about that. In this context, we are all together here on this day to talk about the hardest thing in human life when we feel so lonely that we don't think we matter. And here is a lifeline of somebody that can reach out. But guess what? We are the first defense. Look for people who look vulnerable. Look for things like Samira looked for. She looked for women who needed a place to connect and built a beautiful place for people to connect. And that's what it takes. Open our eyes, see your neighbor, smile at them, ask them, how are you today? Oh, really? You have that going on in your life? Because I can promise you, every single one of you have some pretty crappy things going on in your life. And if I started right now, I'd tell you all mine, but we don't have time. But somebody is there and needs you to be that person for them and to build that beautiful network. And Samira has shown it. You've heard from other people here that have shown you these big ideas. They're all big ideas because they matter to connection. And connection is what is going to get us where we don't need this stuff. But right now we need it.
Thank you so much, ladies. Thank you for the work that you've done here in Utah and the effect that it's had nationwide. It's such a big topic. It's such a great undertaking. I love what you guys said about sometimes our ideas start small, but we don't know where they're going to go or how they're going to get there. And so it's just doing something, and how powerful that message of connection and loneliness and reaching out to other people is to all of our lives.
Thanks for what you do. You've got a big job.
Yeah.
I love what I do. And please, Misty and Barbara. Thank you.